Unfortunately, I'm currently in France, just got back from the airport, and there's a delay in the sound, so it has become a bit complex to find a way to speak to you. So in the few minutes allocated to me, I would like to say a couple of things that I believe that we should have in mind, everybody coordinated on this same frequency called Awakening for Public Health, and a dynamic that takes force and an interest so as to upgrade the existing public health systems. I have followed or participated in many roundtables on the subject. I have realized one thing. The first and biggest precondition that must be observed in order to find this path for the upgrading of public health is to speak the same language. I have realized that many people refer to the necessity of strengthening public health, but listen carefully to what is said. One realizes that this notion, this effort to build up a new public health system in our country is not accompanied by a joint single notion of the desideratum. That's why I believe that it is of the utmost importance to have debate and consensus amongst all the involved parties, all the stakeholders. I will dwell on that for a moment so as to say that the stakeholders in public health are not only the state, the scientific society of medical, university medical faculties, or the professionals. It is an interdisciplinary complex who all participate in public health through their policies, interventions, services offered, and who should participate in such a dialogue and have a consensus so as to agree upon what we wish to create in our country. Perhaps it sounds as something self-evident, but this is not true. For instance, the great confusion on the role of public health and primary care, which of course are interlinked, are two notions that are sister notions, but they're not identical. There's a confusion vis-à-vis the interdisciplinary character of public health. Let us not forget that today the major challenges are, for instance, as the Secretary General mentioned, the issue of obesity. It's not an issue that can be solved solely by the interventions and services of one ministry, the Ministry for Health. Many sectors have to intervene so as to find effective solutions. That is, in the 21st century, it doesn't suffice to say which are the priorities. Priorities are more or less identified and recognized by all. The point is how we deal with those priorities. How can we understand that health is a political choice, that health is synonymous and very close to growth? How can we see the notion of health hand in hand with sustainability, for instance? Then there is the issue of equality. Public health should always be perceived within the framework of a society that has its particularities, its sensitive and vulnerable issues, the issues of working and living conditions, where everybody should promote health. Health is a political choice because it's not on an equal footing for all citizens. The condition which affect our attitude as well and our behavior, because this is a central axis for the management and prevention of chronic diseases, which are of great concern in our century. All these are elements that need this consensus and this perception of the multiple effects of our policies at all levels. The new public health cannot be perceived at the central level, must also operate regionally and at a local level. And they do not entail solely regional services, but actually interventions which will be headed by the heads of regions or the prefects. I'm not saying who is accountable or responsible for primary care at local level. I mean all the conditions. The mayors, for instance, have the possibility to shape the city of the life of the cities, thus, so as to support health at local level. How can you exercise, for instance, in order to fight obesity when you live in a neighborhood when there is no greenery, there is great criminality, and you're afraid to circulate? The notion of a bicycle lane identifies with northern countries or other countries, but something inconceivable in our country, and so forth. So we speak of a whole nexus of public health, where we should first of all understand and perceive that we do not speak of care or prevention, protection and promotion of health and readiness. Not readiness for something one-off as a pandemic. We should know that we've got climate change ahead in front of us, which will shape a framework from which we could expect every kind of threat for public health. And now this phenomena will not be, I don't want to sound as a Cassandra or bring bad messages, but this is something frequent, because integral health is this triangle that links the environment, human community, and the fauna, and all that are interlinked. When there's an imbalance in any of those sides, all the other sides are affected. This is why we need this interdisciplinary approach in public health. Let me conclude by saying that in the current public health, the involvement and participation of local society plays a huge role. The so-called community resilience is substantial. Being able to involve communities and cooperate with communities and make interventions in communities which will be able, during these big threats to public health, will be able to react and adapt, to be positive in finding solutions, to be able to survive, to have sustainability and continuity. This is what I wanted to stress, that the speeches, lectures, presentations, and the conclusions drawn are very useful, and the pandemic has offered a plethora of stimuli so as to redetermine public health in our country as well, and every country should do so. But for God's sake, we should not be led from models of public health that pertain to the past centuries. This opportunity can be offered only through dialogue and consensus at the political level, scientific level, vocational level. And in this framework, Boudosakis Foundation has launched such an initiative so as to create such platforms of consensus and dialogue, to create a strategic plan that will be able to enrich the efforts made by our state and every other agency that would like to positively invest in the notion of public health for the population, completing the care services and all those policies that address or aim at creating quality, well-being, and sustainability. Thank you.